I'm ready.
Okay.
Okay, everyone, so today we're doing an in-service about safe transfers. So before we get into the packet, I just want to ask what your challenges are out there and am I on still? What you find difficult and where you think you're going to be at a higher risk for injuries. Is it during transfers? Is it during bed mobility? What are you seeing out there?
Transfers.
More transfers?
Transfers.
And then you're transferring most of your patients, hardly any are actually bed bound where you're not transferring. Is that accurate?
Mm-hmm.
Well, you have that one
It's a
that I went on
mixture.
that visit with. That's a bed bound, that one would be.
I think that must have been somebody else.
No, we went together, yeah. Anyhow, so, and how are you utilizing those Z sliders? No. So
Because they make the
that's what I
patients
think.
hot and perspire, and the nurses don't want us to put plastic under our patients and cause bed sores.
Right. And the purpose of those Z sliders are primarily to move the patient and then you're to remove that Z slider. So I can understand that that's not real functional for everyone. Okay, so let's go through the packet. Go ahead and sign in and get a packet and a test. Yo, you got?
I sign it.
Okay. Okay, so we're going to do first on that first page, page number 2, a little facts about back injuries. So back, neck, and shoulder injuries are the most frequent and costly type of injuries among healthcare workers. Studies have shown that back injuries tend to happen to healthcare workers during the first hour because your body's not warmed up. So do you find that your back is a little more sore in the morning or towards the end of the day? I would think it would be the end of the day, yeah. So we'll go through a few stretches and whatnot so that we could, you can kind of prevent that. And I know I hear you guys do a lot of driving in between each patient. So you're sitting in the car and your back gets real tight and then you go to your next patient and then the first thing you do is reach into your trunk and lean over and use your back to pull out, all of your stuff. So we'll go through a few little tips to prevent that. Back injuries lead employees to miss over 100 million work days every year. And this is not good. Once you have injured your back, you have an 80% chance of re-injury. So you can't undo that first back injury, right? Okay, so just to review the anatomy real quick, you have your spine and that's very flexible and mobile. And then you have vertebrae, and in between each vertebrae is a disc. And so when you slip a disc, one of those, cushions are out of place, and now you have bone on bone, and then in between each vertebrae, you have nerves coming out of the vertebrae, right? So if they're out of place or that disc slips out, and now your vertebrae are now compressed on there, you now have those nerves being irritated because now you have bone sitting on that nerve. So you would see how you would get pain running down your leg and all those other symptoms that you hear with back injuries. That's why that happens. So they're saying that a heavy belly puts the backbone forward, so it kind of pushes your posture forward, and then that causes pressure on your discs. So if you're 10 pounds overweight, you're adding 100 pounds of pressure onto your disc, and so on and so on. So 20 is then 200. So now you're putting that many pounds of pressure on your back, and then on top of that, you're now lifting, pushing, pulling whatever pounds you have to move. And so once you add that, it kind of compounds the injury risk that much higher. So you're most at risk for back injuries if you bend and lift frequently during your work, and you guys do. Twist your body when lifting clients, which we can all avoid, and we'll go through that as well. Rush when you're performing a transfer, and probably because at the end of the day you're tired And then we start off on time, and by our third, fourth patient, we're more and more and more behind. That poor sixth patient is, we're behind the eight ball by the time we get to them. Or if you ignore your back pain, you have poor posture, are overweight, don't exercise, and smoke. So smoking decreases the circulation to the muscles. That's why smoking is a concern there. The next page, page 3, talks about a no-lift workplace. And we're going to review that real quick because we're not in a facility that would have this policy in place. Has anyone worked in a facility that had a no-lift policy? So essentially what that means is if a patient is a max assist transfer, then that facility, if they adopt that no-lift policy, has that patient be a mechanical lift via Hoyer lift or standing lift. And the only way we can work around that max assist is if we get a second person in to do that visit, or we do use a Hoyer lift. I don't think there's many mechanical standing lifts. Have you seen them in the homes? Yeah, insurance doesn't pay for them and they're pretty expensive, so not too many families have them. But we do see Hoyer lifts, and is everyone comfortable with Hoyer lift use? So that's the gist on the no lift policy, and we'll just briefly go over that just because it doesn't really apply to us, but there's a question on the test about it. So, okay, so body mechanics, and you guys have had body mechanic training at some point when you were very first hired or since. Okay, so you're essentially what your body mechanics is the way your body moves through space while you're doing an activity. So if you're standing and your center of gravity sits right here in your lower belly, and if you reach for something like your bag out of your trunk, your center of gravity falls outside of your body, right? Or if your center of gravity starts here and then you do put your arch in your back and you don't have good posture, then your center of gravity falls behind you. Our bodies want to fall into our center of gravity, so if we're pulling or lifting our center of gravity, we want to go into it. So that's why, have you ever tried to lift a patient and then you feel like you're going into the bed with the patient? That's because your center of gravity falls out of your body. The way you keep your center of gravity inside your body so that your back is straight and you have good posture is to tighten your buttocks, tighten your abdominal muscles, and squat. So if my center of gravity and my patient sitting matches their center of gravity, right now it doesn't because it's kind of up by their head, let's say, right? But if I squat and I pull that patient in as close as I can, now our center of gravities are aligned. So if I do my transfer with one leg out, so I'm pivoting on a moving leg, not a stationary leg, then that will prevent a lot of potential for back injury. So they're saying that there's 9 steps to safe transfers. So the first step is to think before you act. So you plan your transfer. You figure out where they're going to go. You set up your wheelchair, commode chair, whatever, next to the bed. Make sure that nothing's going to slide. We all have those hospital beds with the brakes that don't work, or the wheelchair with the brakes that, even though they're on, the wheelchair still moves. So if that's, test out your equipment and see if that bed slides when you go to lift, or that wheelchair moves. And then, make accommodations for that. Have someone stand behind it, brace it, whatever needs to happen. Then you're going to talk to your patient about your transfer. If they're cognitively able to understand commands and can assist, you tell them what it is step by step that you're going to do and how you're going to need their help. And then a lot of times it doesn't say it here, but what I do is a little trial. Okay, so let's just, especially if you don't know the patient, or sometimes with your patients, they are great one day and they decline the next, and it's so different from day to day. So even the previous home health aide might have had this experience, but today it's a whole different story. So so I always have them sit on the edge of the bed, make sure that they're, that change in body position doesn't cause any dizziness, lightheadedness. So we sit and take a minute. And then I always just do a little sample, transfer. So I say, okay, we're going to just do a 1, 2, 3, stand up, and then we're going to sit back down just to get a feel. And then this way you can assess whether that patient, how much are they assisting you just in this little up and down, right? So if they're assisting you a lot, then your transfer will be a min assist. If you're doing all the lifting, that's going to be a max assist transfer. Same thing with bed mobility. When you roll them over to their side and then you have them sit up, if they're doing most of the work, then it's a good chance that they're going to be able to assist you with that transfer. If they're holding onto that bed rail and you're reaching over that shoulder and pulling them and taking their hip and pulling them and moving their feet, if you're doing the majority of the work, it's a good chance that you're going to do a majority of that transfer. So that's a pretty good indicator in a safe way, because they're not at risk for falls yet, whether, what kind of transfer you're going to be doing. And then, of course, if you need help, get help. So if there's family members that can assist you, that's great. If you need a 2-person assist, you're always able to call the office and say this patient today is a 2-person, so you can downgrade that to a bed bath if it's not appropriate for, a shower or a sitting shower, a sitting bath. Okay, and then set the stage. So we kind of talked about that, making sure there's no obstacles. Everyone loves their throw rugs, and so there's throw rugs everywhere, and that's a big, huge hazard, right? So we make sure that those are moved, and place your equipment where it needs to be. So set your stage before you actually do your transfer. The next step here says balance it out. So you're going to stand like we did before with your center of gravity. You're going to be on a wide base of support. So your feet are going to be wider than your hips. You're going to be squatted down to the height of your surface that you're transferring. And then the leg that's on the side that you're transferring to is your pivot leg. So that leg doesn't stay straight. So your feet will move as your hips and trunk move. So if your feet are forward, your hip and trunk is forward. If you're transferring, those feet shift to the transfer side as your head and trunk do. So you're never twisting on a stationary leg. And then tighten your abdominals and your buttocks. We talked about that. Using your big muscles, so you're going to do squatting and you're going to be using your quads and your hamstrings instead of your back to lift that patient up and move them. Get close, so you want them as close to you as possible. What I always do is have the patient rest their head on the shoulder that we're going towards. And so so that they can see it. If they're able to grab onto the arm of the wheelchair or whatnot, then they're able to assist you. If they feel that they're close and secure, then they won't panic in the middle of the transfer. So the closer they are, the safer they are. Take the breath test if you can breathe while you're lifting. So you don't really want to hold your breath in Valsalva while you're doing your transfers. The next page talks about the mechanical lift. So there's that picture of the Hoyer lift, and everyone's familiar with that. If there's a Hoyer, not all Hoyer lifts are the same. A lot of the Hoyer lifts are the hydraulic cranks. If that's the kind you have, then they're going to be operated a little different than the mechanical lifts, right? So, just familiarize yourself with the equipment, make sure you're comfortable with it. And then there's the stand assist lifts, and those are from a seated position. It mechanically stands them, and then, you can wheel them around. They're smaller, they're more convenient. They're easier on the patient. The patient has to have some upper body strength to hold on. But we don't really see them too often in the home. And the next page talks more about mechanical, especially in facilities and how they're used in the facilities. There's also some other transfer tools are gait belts. Who's using gait belts? Do you guys have the gait belts issued to you, or do you? Okay, so you can request a gait belt and it will be issued to you. Some patients refuse to have them on. There's some contraindications if there's recent back surgery, if the patient has a pacemaker, if they have any respiratory COPD issues. So a lot of times that might not be appropriate for your patient. And then sliding boards. The sliding boards are essentially used for patients who are amputees, patients who have really good upper body mobility but are unable to stand. So those transfers are infrequent, especially for your patients. And then trapezes, I'm sure most of the beds have a trapeze and they're able to pull themselves up. So the next page talks about moving the clients with draw sheets, without draw sheets, with one person, and with two people. So if there's a one person, you're going to be pulling them up in bed. You're just going to be moving them, or moving them to the side of the bed. And they don't have a draw sheet. You're to put one hand under the shoulders, one hand under the thighs, and pull yourself in as close as you can. Sometimes if it's a large bed, it's not a hospital bed, and you can't raise it to the elevation that works for your center of gravity. You can put one knee up on the bed to get yourself a little closer, and that other knee that's on the floor braces into the bed so it supports you, so you don't feel like all of your weight is now on your lower back, keeping you upright. And it brings you closer to your patient, and then you slide them forward. And of course, if you have a draw sheet, you just pull that draw sheet as close as you can, hold on to it as close as you can to the body of your patient. You separate your feet pretty wide, you shift your weight onto your front leg, and instead of pulling with your back or pulling with your arms, you hold on, keep your arms into your body, you shift from your front leg onto your back leg. And so that allows your legs to do the moving opposed to your arms, because I think everyone's legs are stronger than their arms. So those are the draw sheet moving. From bed to chair. So, and these are all things we probably just talked about, but you're going to help your patient sit up. And again, that's going to be a good indicator of how much they're going to be able to help you with their transfer. Make sure the bed's at their lowest position. Even though that bed might be better for your center of gravity to be higher, you want them to be able to put their feet on the floor. So if the bed is able to lower, then lower the bed so they're still sitting on the bed and then they have their feet on the floor. If you don't, you're going to scoot the patient, usually, left side, right side, right side, to the edge of the bed until they can get the feet on the floor. That makes them a little uncomfortable because now they're, on the edge of the bed. So that's only if beds are unable to lower and rise. But if you stand really close to them with one leg in between their two legs, that allows you to be closer, and it also allows you to control the transfer. Apply the gait belt if it's appropriate, bend your knees, and then pivot with your feet and then your body. Okay. And final tips for safe client transfers. stretch and loosen your muscles every day before work. So when we do our body mechanic class, we go through a few exercises that you can do, especially if you're, you just saw a patient and now you're traveling 20 minutes to see your next patient. So you're sitting and your muscles are getting tight and shortened because you're sitting for a long period of time, and then now you're out of the car. Before you get out of the car, you can put your hands on your hips and with your thumbs push your hips into like an extension. So this is called, in yoga, it's called a cat-cow, and you're usually on all fours when you do that, but you're arching your back this way, and then you're now taking your fingers and pushing your hips backwards. And now you're putting a nice rounded stretch on your back. So everyone try that. So you're here and you're pushing with the back of your thumbs on those bones that sit right on your the top of your hips, and you're arching that way, right? And now you're just going to hold that for a few seconds. Shoulders are going to go back, and then you're going to take your fingers in the front and push your hips in the opposite direction. And when you do that, you're going to bring your elbows forward. So you're really rounding out all of those muscles. You're rounding out the shoulder girdle and the lower back muscles. You do that a few times, that'll stretch those muscles out and put you in a warmed up, better position to be reaching into your trunk to get that heavy back out of there. Okay. You must lean forward to work. Support your weight on your upper body on your feet, hand, and arms to relieve pressure on your lower back. Yeah, just because a client is small doesn't mean that he or she will be easy to transfer. And we find that all the time. Those, 80-pounders are just really hard to transfer. And
weight.
Right, and they're not really assisting. So it really depends on the type of assist. So I'm sure, I'm telling you stuff you already know, but if you're looking at this tiny little person in the bed, it may not be easy as it looks, right? If you felt pain or discomfort while moving a patient, then don't do it again that same way. That kind of makes sense, yeah. If you hurt your back during work, let your supervisor know, and then follow policy. How do you know if you have good posture? When we're driving, we kind of tend to sit into our chair, and then we drive. Or we drive, so like that, right? And so that is really not good posture. So if we sit up on our sit bones, if you sit back like this and lean into the chair, you kind of sit on the top of your hips. But if you sit up, you can almost feel yourself sitting on top of your sit bones, right? So that's where your posture is aligned. So your your ear and your shoulder and your hips, and then if you're standing, your ankles are all supposed to be in one line. So if you held a string from the ceiling, that string would go through your ear, your shoulder, your hip, and your ankle. And this is too with transfers with your patients. You set your patient on the side of the bed, and then they're sitting like this, and then you're going to try to stand them. Well, all right, everyone kind of sit like this, and then try to just stand. It's very hard to do, right? So if you put your patients up and you pull their hips into a seated position where they're sitting up on the edge of the bed, it's a lot easier to stand. Their center of gravity is forward and not behind them in this posture. So that'll help with your transfers as well. Just seating your patient a little bit up taller. Remember to push, pull, or roll heavy objects rather than lifting them if possible. Encourage your clients to practice good posture too. So it's the same sort of thing. You're having your patients sit up a little taller so that their center of gravity will be a little more forward, so it's easier to transfer. Okie dokie, I think are we done? Is that the last page? Okay, so does anyone have any questions, anything we didn't review, anything you want to bring up, any particular patient that you're having trouble with? No? All good? All good. Okay, can someone turn that camera off?
What do I press?
That red button in the, yeah, very good. Okay, thank you. My acting debut. Okay, so you want to do the test all together? Yeah. Let's do that, okay. All right, because I have the answer sheet. Okay, most workplace injuries suffered by nursing assistants are the result of lifting, pulling, pushing, holding, carrying, or turning clients.
True.
True. Smoking and being overweight increases your risk. True. Understanding and using good body mechanics can prevent most injuries.
True.
Man, these are tough questions. It's best to tighten your abdominal muscles and hold your breath during transfers. False. A client who cannot bear weight or sit unsupported should transfer with
Hey, hold your
a
leg.
warrior lift, yeah. All mechanical lifts are the same. If you can work one, you can work them all. False. To move a client up in bed alone, all these conditions should be met except for one. What is the one that doesn't apply when you're moving a patient?
They should be asleep.
Right. A no-lift policy means you have to leave your client in bed all day. False. Regular exercise, stretching, and good posture can help protect you from serious back injury.
Sure, true.
Okay, pull in your blank muscles and tighten your,
Sit.
so pull in your
Hold your
abdominal,
abdominal muscles and tighten up your buttocks.
Yep,
That's it.
that is it.
Abdominal and buttocks. Tu panza y tu trasero, mamacita.
So there's those two, the test and then the other evaluation.
Pues es eso que no. We're gonna put that. Want me to plug it?